My name is Nakken. I'm an occupational therapist and a researcher in CRO. Today I want to talk with you about problematic activities of daily life in patients with COPD, and especially about the agreement between patient-reported and proxy-reported problematic ADLs of the patient. We do know that patients experience a lot of problematic activities of daily life and that their proxies also experience these limitations in daily life activities of the patient because sometimes they need to provide care or help to the patient. Therefore, we aimed to investigate the level of agreement between patient-reported and proxy-reported problematic activities of daily life in patients with COPD, and to investigate the level of agreement between scores for satisfaction and performance of these problematic activities of daily life. We included 194 patients and their 194 proxies. All patients had stable COPD. Almost half of the patients had COPD Gold Grade 2, a third of the patients Gold Grade 3, and 20% of the patients had COPD Gold Grade 4. In total, 830 problematic ADLs were reported by patients and 735 by proxies. The level of agreement between patient and proxy-reported problematic ADLs was poor for the domains productivity and leisure, to fair for the domains self-care and mobility. The problematic ADLs which were mostly reported by patients and by proxies were walking, stair climbing and household activities. Horizontally, the performance score given by the patient is shown, and on the vertical axis you see the score given by the proxies about the patient's performance. A balloon represents the performance score for equally reported problematic ADLs. And as you can see in this figure, a large variation for performance scores by patients and proxies is shown. Indeed, in 49% of the cases, the scores differed 2 points or more. Exactly the same performance scores were given in 24% of the cases. And this figure is almost the same, but now for satisfaction scores. So on the horizontal axis, the patient-reported satisfaction score is shown, and on the vertical axis, the proxy-reported satisfaction score. Again, large discrepancies were found between individual patient-proxy pairs. So this study showed that it is important to involve proxies, besides patients alone, during patients' identification of problematic ADLs.